The better known examples of MindGen concern products, but MindGen is useful for cracking any type of problem. Let's talk about healthcare. As you know, one critical issue facing every hospital is how to reduce readmissions by improving patient outcomes so that the healthcare provider is not penalized when patients return in 30 days or less. Their financial health and ability to keep providing services is at stake. So let's talk about St. Mary's Hospital, where MindGen helped them have superior outcomes for patients and financially for them.
You know, we're going back to 2012, and I had been talking about the potential use of this to make better foods, better products. And Sam Palazzolo said, I know the head of St. Mary's Hospital in Rome, Amsterdam, New York, that area. Do you think you could apply your work to living better? I said, that's very interesting. Let me try it. So we got together a variety of different phrases about living better, what you should do. And we mixed and matched these by experimental design, this recipe book. We gave it to 250 normal people. We got the responses, and we could find out what each of the measures, each of the elements, the phrases meant. And we found that there were different phrases. One set of phrases talked about living better. Another one talked about seeing your grandchildren. Another one talked about how your doctor knows the best for you. Another one talked about you'll live better and have fewer diseases. So you have to imagine us taking these messages, which we did not know would work or not, mixing them together into small ads or even small refrigerator magnets, presenting these in different combinations to 250 people, normal across the country, and deconstructing the response to what every element brought to the party, namely, could I live with this idea? When we did that, we found that there were three radically different mindsets. There was a mindset who thought, I want to live to see my grandchildren. There was another mindset which said, my decisions are my own. And there was a third mindset that said, my doctor is my friend. And what was interesting is that these were three different groups of people, different mindsets of people who were demographically very similar, health-wise very similar. We figured out that if we could give the right message to the right person who was being discharged, we might affect their rate of being readmitted and their health. So you have to imagine the study with normal people mixing and matching, getting people to evaluate combinations, deconstructing the responses, and finding that there are three different mindsets. And we had a way of predicting from a simple test which patients belonged in which mindset. So guess what we did? The natural experiment. We had two wards. One ward, both for congestive heart failure, CHF. One ward had patients who were released, and they were typed by being asked 6 questions. We found out what mindset they belonged to, and we gave them a refrigerator magnet of the words that were positive. The other group was not given the magnet. They were just released. Those who were released without being tested, 17% of them, or the national average, were readmitted within 30 days. Among the people who we gave the right messages to, less than 5% were readmitted, and of those who were readmitted, almost all of them over a 2-year period was in group 2, which was the group that said it needs social cohesion, social reinforcement. So I think that there's something there to significantly reduce the health issues of the country.